Hi, everyone. Welcome to our webinar. My name is Laura Erickson Schroth. I'm the Chief Medical Officer for the Jed Foundation, which is a national nonprofit that protects emotional health and prevents suicide for teens and young adults. Welcome, and thank you so much for joining us. I have some really wonderful panelists here with you today. I'm going to start by telling you a little bit about the Jed Foundation and then introducing the topics that we're going to be talking about today. And then, we're going to have the panelists introduce themselves and we're going to dive right in. So to start off, to tell you a little bit about the Jed Foundation, we were founded by a couple named Phil and Donna Satow, who lost their son, whose name was Jed, to suicide while he was in college. The Jed Foundation has been around for 25 years now, and we work with schools across the country. We started off our work with colleges, and now a third of US college students attend a Jed campus. We also work with high schools and recently started working with pre-K through 12 school districts, as well as youth serving community-based organizations. And what Jed does is we go in and we provide technical assistance and strategic support to help schools and organizations to approach mental health and suicide prevention. And we also provide resources for educators, for young people, for families and caregivers. And that's one of the things that we like to do the most. We have a lot of these kinds of conversations, and we really like helping, everyone to come together to talk to each other about really important topics around mental health. So today we're going to be focusing on suicide prevention. September is Suicide Prevention Awareness Month. And from the beginning, Jed has had a focus on, talking about what we know from research and putting that into action, really talking about the practical implications of research and what it means to really learn about how to talk about mental health and suicide prevention in our communities. So, at Jed, we emphasize the importance of talking very openly about mental health and about suicide. And today we brought together three really spectacular people to have conversations about the real life practical questions that many of us have around suicide. After we introduce the panelists today, we're going to be spending some time on really common questions that we get at Jed about suicide, about talking about suicide, about how to approach it, how to recognize someone in your life who might be having suicidal thoughts. And then there's going to be a chance later to ask questions. So if you're in the audience and you have something that you'd like to ask, please direct it through the Q&A function. We also got some questions before from many of you who registered for the webinar and sent in questions. And Jed staff will be monitoring the Q&A and looking for any questions that pop up. And we'll do our best to answer as many of those as possible. So I'm going to move on to introducing the panelists. Oftentimes, panelists are introduced sort of by reading their bio. So they have a paragraph that's posted, and then we sort of go through and read those sentences. And I really like when panelists introduce themselves because I really think it tells you something about, who they are and what's important to them. So I'm actually going to ask the panelists to introduce themselves. And I'll start off with Christine Moutier.
Thanks, Laura. It's great to be here with everybody today, including you, Laura, and Jocelyn and Jose, and everybody who has joined. We are so excited to kind of hear from you and know what's on your mind. So really looking forward to this. I am the Chief Medical Officer at the American Foundation for Suicide Prevention. So Laura and I are like counterparts and colleagues in this national work of suicide prevention. I've been in my position at AFSP for 11 years. I'm a psychiatrist. And before that, before coming to AFSP, I was actually a volunteer for AFSP in San Diego. Now I live on the East Coast where AFSP is headquartered in New York City. I came to this really kind of interesting. You'd think a psychiatrist, it's all clinical and patient related. And of course, I care about patients. a ton, but it was actually my own lived experience when I was a medical student, and then the loss of physician and nurse and trainee colleagues to suicide that really caught my attention. I'm also somebody who is in a family with people with ongoing lived experience, meaning some mental health conditions and mental health to manage. And so at AFSP, we're in this science meets grassroots work because we have chapters across all 50 states and Puerto Rico, and they keep it real for us. And also in my own life, it keeps it real for me too. So I love this conversation because it's about how do we translate all this important science and evidence and best practice into our real lives, wearing all of the hats that we all wear many different hats. So anyway, that's a little bit about my background.
Thank you so much, Christine. You all are going to love all of our panelists. Jocelyn Metza is up next.
Great. And thank you so much for inviting me to this important conversation with you all. My name is Jocelyn Mesa. I'm an assistant professor in psychiatry at UCLA. And both my research and clinical work are around suicide prevention, and really understanding the structural and social cultural issues that are associated with suicide, and developing treatments that take into consideration not just structural barriers and structural issues, but also social cultural practices that we can embed and integrate into the work that we do. As a Latina first generation faculty member and clinical psychologist, for me, what brought me to this work was seeing a lot of the suffering that was going on in the Latino community, the really high rates of suicide now in children. Latino children ages 8 to 12 have a twofold increase in deaths by suicide in the last 20 years. So a lot of the work that's happening in my community is what's really motivating me to be here. And also the resilience that's in the communities, not just the suffering, but also a lot of the beautiful resilience in the community. So I'm excited to be here to talk about how my work as a clinical psychologist in a clinic that focuses on suicide prevention, how we can share what we've learned in the last couple of years that we've been doing this.
Thank you so much, Jocelyn. And Jose Caballero, you're up next.
Hi, everyone. My name is Jose Caballero. I'm a rising junior at Columbia studying cognitive science. And first and foremost, I'm beyond thrilled to share space with all of you. Truly an honor to be here. A little bit about me. I was born and raised in Nicaragua and then moved to Miami in 2018. And I came to this space, to the mental health space specifically because I saw a lot of my fellow immigrants having suicidal ideation and attempting. And it was really sad to see the struggle and to not understand how to help, being in the position of trying to help people and also losing friends to suicide in college was really sad and devastating. And I'm very excited to join this conversation. I think that Christine a little bit alluded to my work in the field on translation. I love research. I think that research is advanced knowledge and understanding of society and our lives. And that's precisely what I do as a student researcher. I make sure to translate research to Spanish speakers and in the Hispanic community and making sure that research is accessible in their language. And very excited to be here.
Thank you so much. I'm very excited to have all of you here and I'm ready to dig in. So one of the most common questions we get at Jed when a lot of times talking with teachers, talking with caregivers is, what are some of the warning signs that someone might be having suicidal thoughts? How do I know if there's a young person in my life who I should be sort of more attuned to or paying more attention to? And how might those signs be different for different people? So if there's anyone who wants to start us off, go ahead and jump in.
I can start us off and then really looking for those more nuanced things that you all are seeing. But at AFSP, we talk about warning signs in 3 categories: talk, behavior, and mood. And when any of those things start to change, honestly, it can be that, like trusting your gut instinct, but certainly if they are talking about feeling hopeless, overwhelmed, trapped, or like they feel like a burden to others, if their behavior changes towards withdrawal or towards like quicker to anger, agitation, using substances more, all of those could be signs that their mental health is changing and that they might be having thoughts of suicide. And then mood could look withdrawn, again, more anxious, more depressed. And so, but to me, it's about engaging the person if your gut instinct tells you that something is they're not showing up in their characteristic ways.
Yeah. Can I also add to that? So above and beyond the thoughts, behaviors, and mood that kind of are indicators, I would also say look at connections. So are the people that you're concerned about, are they connecting differently to other people? And in terms of like culturally congruent ways for Latinos, family is at the core of a lot of our values. So if there's changes in the way that a person is connecting with their family members, maybe they no longer want to go to the family parties, or they no longer want to be in collective spaces, that may be an indicator that something may be, different or disrupted in the connections that they feel to others.
Yeah, that's great. I want to reply to this question from the perspective of a young individual. And I think that it's pretty interesting in bringing the Gen Z perspective here. Pretty interesting how my generation has glorified the idea of suicide in a very joking kind of way. I think that to that extent, it's pretty interesting to see where it's a joke and when it's not a joke anymore, because I do see in a lot of social media spaces that a lot of young people, even younger than me, are using language, very suicidal language, in a way that clinically it will appear as a sign and as a risk, but culturally for us it's more of like, I don't want to say a norm, but it's more glamorized as a way of like saying that we are stressed and we need help. Not that we need help, but my point that I wanted to make here is that I think there's a difference between ideation and actually thinking about methods and trying about the method. I think that is a huge concern that I had sadly had to see in a lot of my peers thinking about method and methods of how to do it, and I think that that is a high risk. But again, I just wanted to bring that perspective of understanding the generational perspectives and just trying to see how young people interact and these dynamics that, for at least for my mom, may seem very very warning, and that you need help, you need to be in the hospital right now. But for us, it's kind of it's different. So I thought I just wanted to point that out, and I thought that it was very interesting.
Jose,
Yeah.
I'm so glad you brought that up. Jocelyn, if you want to add to that, I was just going to ask, so what do we do with that? If someone makes those kind of statements, how do we know with a young person who says something, how to react to them if they, say something about suicide and we're not sure if it's in a joking way.
Yeah, Jocelyn, do you want to add something before? I'm sorry.
No, go ahead. I want to give you the opportunity to follow up on that.
Yeah, so I think that just to expand on my response, I think that among young people, we know the times where we use this kind of language and with the people that we use it with. Um, for example, so a Gen Zer wouldn't use this kind of language with Christine, I will assume. Because there's a difference in the dynamics and there's a difference in the understanding that we both have, and it's more like a serious way. But I think that internally, from my perspective, when I see my friends using this language, sometimes it bothers me. Sometimes I'm just like, okay, it's okay, it's life. You're young. I don't know what to tell you, but I can tell personally when the joke isn't a joke anymore. And I think that going back to my response of like the method, when a friend is talking about a method and is telling me that they're constantly looking for research or like researching a method, I think that that is the breaking point for me. That is the threshold where I'm like, yeah, this is not normal anymore. This is not a joke anymore. That could be wrong. And also, I think it's fair to say that from what I've read from the literature on suicide, a lot of clinicians and a lot of research has shown that they don't agree on the risk and on the signs. There are a wide variety of signs and there are a wide variety of warnings that people give. So I don't want to generalize it, but I just wanted to bring that point of Gen Z, making sure that should language be a risk and when is it not a joke anymore?
Yeah. And I would add to that, I think one of the most important things that we do when we have a friend or a peer or a family member that is disclosing that they feel or that they've had thoughts of suicide is to that our reaction be empathic and to be curious, to want to understand more where they're coming from. A lot of the times when we have an overly alarmist reaction, it could put the other person off and say, well, maybe I shouldn't share because they're going to, become more dysregulated than me. Right. So at that moment, when someone is disclosing, it's important, A, to remain calm, B, to be curious to ask more. So it sounds like you are really struggling. Have you actually had thoughts of hurting yourself? Okay, so you're sharing that you're having thoughts of hurting yourself, and I'm just really worried about this, and I want to make sure that I can help. Have you thought about how you would do it? So this is going back to Jose's point about having a method. Usually, when there is thoughts and methods and intent, that is a pretty powerful combo for increasing the risk of suicide. So for intent, some people might have a plan, but they say, I would never do it. Okay, so what's stopping you? What are those things that are keeping you alive? What are the things that are stopping you? And if they say, yes, I do have thoughts of going through with that plan, that's when I think we're going to share some tips in a little bit. What do you do in those cases where you have that trifecta of thoughts, plan, and intent? Because those, I think, in general, those are the three, I would say, the combination that yields the highest risk. And if they have the means to carry out those methods, right? So we also want to do a lot of counseling or understanding on, do they have the means to carry out that plan that they're saying? And like I said, trying as best as you can to remaining calm, to really give that person the space and opportunity to share with you. Dr. Moutier, would you add anything to this? What do you think?
No, I appreciate this conversation so much, and especially Jose, what you're saying about the Gen Z and the younger perspective is that suicide is so part of the culture in a way, and maybe normalized in a way, which on the one hand is a good thing to be able to talk about our suffering and distress with no stigma. I think the thing is, sometimes, the way I look at suicide risk and prevention is that we want to alleviate any risk factor, any suffering. So even if the person is having suicidal thoughts, but they haven't progressed yet, and maybe never will, but many do, to move on towards, further planning and action, I wouldn't wait until it's at that level of necessarily, really set with a method and a plan. I think that any even kind of fleeting thoughts of suicide indicate that something is happening in the person's mind and brain, that they're considering coping strategies, they're working through things. And so in that sense, suicidal thoughts can be very common, can
Mm-hmm.
be part of just the brain's working through options to alleviate suffering. These people who die by suicide, it is not the case that they were just, kind of focused on death and dying. That's not it at all. It's about finding meaning, purpose, alleviating
Yes.
suffering. And so I think any way that we engage people, like you said, Jocelyn, to show empathy, curiosity, compassion, support,
Mm.
connected, whatever their suffering is, whether they're having suicidal thoughts or not. So I think the really kind of beautiful upstream approach is where we create relationships and environments where all human struggles are
Mm-hmm.
just part of being human. and we can be in it together. We can be sharing those burdens with one another. And then certainly if it moves into more like thinking about suicide with a particular method, then absolutely that's where, we can talk about how to manage that situation. But I like to think that the younger generation is not only normalizing the suffering and the topic of suicide, but like really normalizing that we're in it together, that there are challenges, that's a normal part of life. I think in some ways, it's like my generation, the parent generation, was so anxious that they couldn't tolerate the suffering amongst the next generation and just found a way to make it also protected and safe. And in a way, that didn't allow us to really grow the muscle around sharing that we are all going to hit unpredictable, messy challenges. That's just simply part of life. And so anyway, it's a little bit more of like the parenting thing around. I wish my generation hadn't gone down that idea, which is false, that we can just kind of sterilize and make things so safe, because we might have overly focused on things that didn't emphasize this idea that it's okay to struggle. In fact, all of us will at different times, in different ways.
I was going to do a mic drop after that one.
Yeah.
Yeah, really bringing it together for us, Christine. I think that leads into another common question that we get, which is about, so how do you create an environment where you can kind of talk about these things, even when it's not, I don't know, the most difficult time someone has been through. How do we create environments and use language that's positive about mental health, and encourage sort of talking about emotions and talking about them in ways that are, non-stigmatizing? What's the language that we use, and how do we sort of set up those conversations in our communities?
Yeah, I just want to say that the language that we use to talk about suicide can also be very stigmatizing. So it's important that we think about the impact that our words have with others. Some of the most common ones that I've heard is the term of like commit suicide, right? Which can sometimes send the message of like criminalizing mental health, and changing our language to saying someone died by suicide. They didn't commit a crime. Um, Another really big one is when people ask, are you suicidal? Or refer to someone as being suicidal, as if it's a personality trait or someone that's inherent to them that won't change. So when we use that to describe someone, we're kind of attributing it to them as a person rather than something that they may be thinking about. So changing are you suicidal to are you thinking about suicide, because then that becomes something that's outside of the person. Those are, I think, two of the more common language that I would think is it's important to also talk about.
Yeah, and from the perspective of a student, I think this question is really hard. Not only because I think that there's a lot of stigma surrounding suicide, but especially because the system within students have to work with doesn't allow room and flexibility for us to openly have this discourse with a professor, with an RA, or with even students. Because at least in college, if you go to a professor and you have a discussion about how you're feeling and about your thoughts, there's a system that they need to go, they need to report that, and they open a whole investigation and a whole case for you, for the individual who just share their thoughts and their struggles and their thinking. And I think that creates more stigma to talk about suicide on campuses, because it makes it seem that the student is a liability to the school and that you're not emotionally competent enough to be at the school. And a lot of colleges invest a lot of money in making sure that there are cases for singular cases for students who report feeling a certain way that is not the stereotypical student. And I think that that's on the side of students. I also think that from my immigrant community, there's this thing called systematic shame, which is when you talk about your emotions as a Latino immigrant, you're you've seen you see they see yourself as a shameful because you came to this country to work really hard, and we've been through a lot in our countries politically and mentally, so you should be capable enough to take care of your mental health and to take care of yourself. You don't need help. But what works for me and what has worked for my friends, it's always coming to terms and actually challenging the judgment and the thought that we have. Because if there's something that I've learned throughout my youth, throughout my time up to this point, is that all thoughts are not facts, right? A thought can be a fact, but not all of them are facts. And usually a judgment is not a fact as well. And if you really think about it and challenge that judgment, I mean, an example is I usually get stressed with finals and I think I'm very incompetent and I think that I don't deserve to be there. Eventually leads to a very dark place in my life. And I'm usually challenging that judgment of I'm not incompetent. The work, the classwork and the workload is really hard and it takes a lot of time. But that doesn't mean that judgment of me fooling myself and saying I'm incompetent, I suck at this. No, I'm not. I'm just pointing out the fact that coursework and classes take a lot of time and a lot of thinking. And I think that has helped me with these thoughts that my mind oftentimes wanders around, and that has helped me and my friends recognizing the judgment that you're making about yourself, and then challenging that judgment, and then either doing something about it or just making sure that you are okay has helped me.
I think about the ways that our relationships, whatever it is, with friends, with coworkers, and within your own family, that is where the opportunity, everyone has a role to play in suicide prevention, because we can all work on developing a self-awareness and a focus on psychological safety. That if we create environments, and I guess part of it is getting educated yourself first and maybe challenging your own kind of internalized fear, shame, stigma. Those of us who work in suicide prevention, oftentimes my path included a life-changing experience with psychotherapy where I really had to challenge, just like you're saying, Jose, with these punitive self-views, that when you go through that transformation and you believe I'm worth the space I take and the air I breathe because I exist, not because I earn it in some other way. And if you believe that about others and about yourself, then there are little ways that you can create that psychological safety that says nothing you do or say is going to change the way I feel about you. We certainly can say that to our children and our loved ones. No challenge you face is too big or going to cause, judgment to fall upon you. We're going to help each other get through it. And other parts of psychological safety that are a little more subtle are like monitoring our own behavior, especially in terms of anger and irritability. There's nothing that will shut down the environment of psychological safety like temper outbursts and judgmental, snappish, and a lot of that is kind of used in humor, but then you have to really reflect, when does it cross the line that it's actually creating a feeling of pins and needles that people are walking on? So anyway, these are hard changes to make on your own, and I really am a big proponent of seeking out some therapy or journaling, being on that path of developing deeper self-awareness, because then we can start living in that freedom ourselves, and then also become curious. So that, Jocelyn, like you were saying, when someone is struggling, rather than jumping right to offering them a solution, which in my role as a mother, I have to be so careful about, and I'm
Yes.
terrible at it. And I have to say, shout out to my husband who he has learned how to just say, I'm so sorry you're experiencing that. Is there anything I can do to support you? I'm like, he is like the model compared to me, like, so we have to be so careful at our own instincts that want to just fix the problem or give our expert opinion. That's really not what it's about in those moments.
Mhm.
I love that you're opening up this conversation around how do we do this? How do we respond to people who are reaching out to us in our lives? I'm thinking about Jed conducted some research this past year with teenagers, talking with them about, what are the ways that adults in your lives respond that are the most helpful or not helpful. And one of the things they said the most was adults are running in to help, and give solutions and fix things. And what they really want is someone to listen. I think you're exactly right on that. I wanted to sort of ask of you all in terms of your own experiences, either being someone who is reaching out for help or someone who was, helping someone that who was struggling. What do you think's made it easier to either open up or to help the other person to open up when they're struggling with something, mental health related or with suicidal thoughts? Jose, do you want to start?
Yeah, of course. I think what I find interesting is that going back to my comment earlier that my generation sadly has glamorized the idea of suicide. Um, the people that are using this language to convey any kind of sentiment, emotion that they have, they're not the ones that have lost. The ones that have lost to suicide were the ones who never talked about anything and seemed to be very happy and very put together and taking really hard classes, constantly challenging themselves and making sure that they were that they I felt a connection with them, and all of a sudden they were just not there. And I think that's a very interesting point because it's oftentimes the case with young people that we're always looking for the little signs, and yeah, you feel this way that leads to that, but it's so unpredictable as well. But I think that going back answering the question, I just wanted to point that out. I think that small steps really help. As we have been talking about, I don't think that giving them an individual a solution, here's the solution, really helps. I mean that a lot of my friends have opened up with me when we are baby steps, step by steps. We get ice cream, we go for a walk, and having these are really hard conversations to have as well. I wanted to point that out, and always my professors always tell me that I'm very idealistic and very hopeful because at every class I bring this kind of like compassion lens to the discussion because these are really hard conversations to have in the first place. And I think that finding that lens of compassion and empathy, as we have been talking about, is the first step. And it doesn't have to be a huge step of here's the solution, this is the plan for you. I think that small steps like getting ice cream with a friend, laughing about it, going to concerts together, or even listening to music together really has helped me and my friends find a way to cope, find a way to heal as well. Because eventually, healing is not a doesn't take one day. Your thoughts are with you forever, and I think that as well, knowing how to regulate and control your mind is also a skill that you learn later on in life. I think I'm not quite there yet, but I think that the mind is very powerful. It's a very powerful organ in our bodies, and learning how to regulate it and control it, I think that it takes time, but again, small steps.
Thank you. Oh, Christine, go ahead.
I was just going to say that in a different setting, like in a workplace, you can actually signal to people that it's safe to talk about what they're going through by going first in a way, by, just adding into workplace conversations that you're going through this challenge and people who mention their own therapy, their own treatment casually in the workplace. I have utmost respect for that because they're setting a tone that just told everyone in that work environment that I believe this is something good that anyone can avail themselves of. You just gave tons of people permission for that. And you'd be surprised. You don't have to be the supervisor or the boss in a workplace to affect the workplace culture in that way. So just taking a little bit of a risk and sharing probably more because our social norms are really bizarre around mental health. They really led all of us at a young age to believe that it was weakness rather than that we all have human health, and mental health is a part of that. And it's very dynamic. It's normal to have feelings and struggles. So part of it is that we're trying to start from the basics and lay a new public health approach with an understanding about mental health. But all of us are in it. We can all, play a role, like I'm saying, in the workplace or at your faith community or when you're playing sports, that works this in a way that you yourself just create an environment so everyone around you knows you think it's real and it's important and it's strong to seek help and, get treatment.
I'm glad you brought that up, Christine, about sort of everyone in our communities that can do that. We can do that in our families by, talking with our children about, our own emotional health, that sometimes we go through difficult times. These are the things that we do to cope. Like, I really like to exercise because it really helps me, or, your dad likes to do this. It's really helpful to him. We all go through really difficult times. And I agree with you on the, coaches and teachers and anyone who comes into contact with young people. And for a lot of us on the call, that's, in the workplace, like you said. There are a lot of young people coming into the workforce, and a lot of it is on Zoom. And so if we can, just drop little hints about, this is an okay thing to talk about. I was going to sort of, move to some of the kind of common questions that we get about having these conversations. One of them is, I often hear from people the question, won't bringing up suicide put ideas in someone's head? So is that true, or is it, a myth? How can we talk about this? Should we bring up suicide? Will it give people ideas?
There's a lot of strong research, at least 4 or 5 studies that have shown that asking someone that you're in a conversation with about how they're doing and you're expressing caring and support, that asking about whether they're having suicidal thoughts will not increase risk. It doesn't plant a new thought in anyone's head, and it doesn't make it worse if somebody is already having suicidal thoughts. I think there could be some confusion around the topic of suicide contagion, which is a whole different thing when the media or when a suicide occurs, let's say in a school or a workplace. And if the messaging around that is very sensationalized, focused on the method, glorifies the suicide in a way that says that struggle was inevitable to end in suicide. There's a number of things that have been shown in research that suicide and contagion can occur, but it is not in the context of having a caring conversation and asking somebody.
Jocelyn, did you want to add to that? I saw
I
you.
mean, yeah, I was nodding. I echo a lot of the things brought up already, that asking about suicide does not increase or put any ideas in someone's head. It actually has a therapeutic effect. We have seen in many studies that asking someone about suicide, and if they are thinking about it, it could feel very validating to them and it could have a therapeutic effect, which is why we screen for this in different clinics, right, to ask about suicide.
Yeah, and just go ahead, Dr. Lara, sorry.
No, go ahead, Jose. I didn't know you wanted to say something. Go for it.
Yeah, I was just gonna say that I agree. I don't think it puts the thought into anyone's head. I think that it's also interesting to see the different depictions of suicide, not only in the media, but also in literature and in the different books that we read, and how this has perpetuated the stigma around suicide in different ways, in making it look that it's a crime again, and that it's very sinful and it's very immoral in a lot of ways. And I think that talking about it is just challenge those misconceptions and those preconceived notions and ideas of suicide. So I definitely don't think that it's a bad thing.
And what about one other common question we get is, what if you see that someone is in distress, but they don't seem to want to talk about it, or they deny it? I'm wondering, how about Jocelyn? Do you want to start your nodding?
Yeah, because this happens so often, right? I think that the way that we ask about suicide is also very important, to also think about how suicidality manifests in different groups. So one example that I want to give is with Latino or Spanish speaking communities. There's the PHQ-9, right, which is the gold standard for screening or assessing for suicide risk. And the ninth item says, do you have thoughts that you would be better off dead, right? And when we ask people in the Latino community, they say no. I don't think about me being better off dead, me being better off if I were dead. I think about my family. I think my family would be better off if I were dead. So sometimes when we switch or kind of change the way that we ask about suicide can make someone feel more likely to disclose, right? If it matches the way that they're thinking about it. So another potential way that I've asked about it is, have you had any thoughts about just wanting to go to sleep and not waking up? I get so many yeses to that when I ask about that first, because I think it kind of opens the conversation about feeling distressed. And then when they say, well, yeah, actually, there's been some times where I just wish I could go to sleep and not wake up. Well, how does that feel? What are some other thoughts that are associated to that? So sometimes starting broader and kind of narrowing in on our approach can make it easier instead of going right into, well, are you having thoughts of hurting yourself?
And what about if someone shares that they are having suicidal thoughts, but they ask you to keep it a secret? Is it okay to keep this kind of thing a secret? How do you talk to them about that and them having asked you to keep it a secret? I wonder if Christine wants to take this one. This is probably a common question for her too.
Sure. Yeah, it's a hard one because when you're in this kind of conversation, the person is really taking a risk in some cases, opening up to you. And so they may say things like, well, will you promise you won't tell anyone else, about what we're talking about? And I would just, the way I would say, please don't promise to keep it a secret. And the way that I would do that, but still encourage the conversation to continue, is to say, I care about you so much, and I can't make that promise because we're going to work through it together and figure out the best next steps to take. But opening up now in this moment, we have this opportunity, to talk and for me to learn about, I'm back to what Jocelyn said, be curious. Your job is simply to want to learn more and to open up those open-ended questions to say, when you talk about that stress, because remember, people will always talk about the situation of the stress that they're carrying, relationships, school, work, finances, breakups, discrimination, any number of like really difficult things. That's the language of mental health. They're not going to say, I'm feeling depressed or I'm having suicidal thoughts. That's not usually the first thing that pops out. It's about people's real lives. And you can always just start it out by saying, I hear you in these situations you're describing. It sounds like hard. It sounds like a struggle. When you're experiencing that level of stress, or you can use their words, whatever it was they used to describe their feeling about it. When you feel that way, do you ever have thoughts that you'd be better off dead or others would be better off? Or just simply thoughts about ending your life? That's usually the shortest way. So you can use the word suicide, or you can just say thoughts about ending your life. And again, if they say, well, promise you won't tell somebody, you can say, I really can't do that, but I want to hear what it is you're experiencing, and just reframing back to your support for them. And some people won't open up. Some people aren't ready to seek help, and that is okay. You can be patient with that. You can come back to them later. And I think try to put your own, sometimes it feels like maybe it was me, maybe they don't trust me enough. I wouldn't assume any of that. I would rather realize that people are in their own journey, and they're not always ready, right, to share or to take that next step. But don't give up. and don't assume that you don't have influence over them, even if it felt kind of rejecting in the moment. They're going to think about that feeling you left them with of love and respect and caring and being interested in their mental health, and whether they're having suicidal thoughts will stay with somebody, and it could affect the way that they then, progress into their next day or their next opportunity.
Thanks, Christine. Anyone want to add?
Yeah, I think that for a lot of young people, there's this fear of not only keeping it a secret, but what happens after I say it, right? Because as I pointed out earlier in college, that's what happens is that eventually open a case for you, and then eventually you end up in I don't know where. But I think that the idea of gatekeeping your feelings and keeping things as a secret is also due to the storytelling and the depictions of suicide in the media, that if you call this number, you'll get hospitalized or the police will come. And I think that a lot of young people, that's a fear of keeping your thoughts and keeping your struggle as a secret. And I think that I just wanted to add that, but I think that what Christine said beautifully points out everything. But I just wanted to add that point.
Thank you. Because we only have, it looks like about 12 minutes left in the webinar, I wanted to move to a couple of the questions that we got that were sent in by audience members. One of the questions I think is a really common question, which is, people often say, reach out when you need someone to talk to. But this person said, when I do reach out, often people are busy, or once they hear about what's going on with me, they may start to distance themselves. What sort of thoughts do you have for someone who's going through something and being told, reach out, but they're not really finding some place to land or someone who's responding?
Yeah. I would say in this situation, when you do want to reach out and you are reaching out and it's not landing on, or someone's not being as responsive as you need in that moment in time. So also think about more formal help seeking. So there's different types of seeking help. There's informal, that's when you reach out to a friend or a family member, a colleague. And then there's formal help seeking, when you reach out to a provider like myself, when you're in moments of distress. So hopefully this person can feel comfortable in reaching out for more formal support, since we are there to support you for just that. And if you do have a friend that is struggling, sometimes it helps if you're the one reaching out and not waiting for your friend to reach out, because that makes it just easier for some people to feel heard and understood.
I like that, thinking in advance about maybe I can be the person that, like Christine said earlier, drops hints about, I am an okay person to talk to if you want to reach out. And that's, you don't necessarily need to say, hey, reach out to me if you have, something going on. You can sort of, talk about your own, emotional life and the things that you do to take care of yourself. And that makes it, obvious that you're someone that might be okay to come talk to.
Mm-hmm. Yeah.
We have a question from the audience. How can we help change the narrative in talking about mental health so that it's, more acceptable to talk about, that it's more like physical health? Do you all have any thoughts around how do we change those narratives on a sort of larger level?
I mean, again, I think it's about the different hats we wear. And so, I'm just making it up, but let's say you're a teacher and a parent and a member of a community group or a faith organization. Those all afford you different opportunities to weave it into your work and your life, messages that just, again, you have to truly believe this. So that's the first step. If you're struggling around that, is just some therapy, some education, talking it through. But once you really believe deeply that mental health is part of human health, then it can affect the way we navigate our lives. It can mean encouraging others to learn more about mental health. It can be simply stating that, when a colleague at work is facing some type of challenge, that you say, if this were your physical health, like, tell me how you might approach that. Do you think this is, kind of a similar situation? So for me, physical health is a nice go-to kind of like constant friend in this situation of grounding yourself in what would you do if it were physical health? And there's probably a corollary that's pretty similar around what we can do for our mental health.
Thank you. Another question that we have is someone was asking about what are ways that high schools and colleges can support, teachers, other staff to be able to sort of best help students who are struggling. And I think, Jose, you certainly brought up that this is sort of an issue in how it works in schools. And I'm curious if any of you have thoughts on, what are some of those best ways?
Yeah, I think in this case, shouting out the Jed Foundation, but I think that in this case, it's bringing those partnerships, those external partnerships, because I feel that a lot of schools lack the assessments and the data from their own students as well, because I feel that oftentimes schools rely on outside data, which is beautiful. I agree that it's needed, but I think that a lot of schools don't have their own data on how students are actually feeling. And I know that's the work that Jed is doing with Jed Campus and Jed High School. So having this partnership with organizations like Jed and making sure that the school has a sense of the climate of their own campus, I think it's essential, because if they're relying on external data that doesn't tell you anything, well, it does. It informs and it makes you aware and understand the issue at large, but you really need to understand the people that are being affected within your own community, because I think that's in the case of schools, that's where we need, and also understand who is present when you're having those kind of conversations about how to make the waiting list, for example, in a lot of clinical facilities on campus less, making sure that we are using and just bringing in the voices that really are needed in this kind of conversations.
Thank you. Any other thoughts on that one?
Just, Jose, what you had said earlier about, in a way, an overreaction that some campuses have to students who are suffering and going through challenges. They might be having suicidal thoughts. That
Mhm.
does not have to present a liability to campuses. That's always been the case. And in fact, a punitive or an overreactive response is going to actually worsen the culture and create a sense of like, I can't talk about what I'm going through. There should be no punitive consequences associated with any kind of health situation. Again, compare it to physical health. Would there ever be? No, there would be accommodations and support. So I think, schools can look at their policies and practices through the lens of, am I addressing it without stigma and in a similar way that we would offer support, and engaging the student, the culture, training staff, and also training the parent community as much as possible, so that because there can be some really strange ways that it plays out that aren't, they might be checking a box, but it's now gone astray from the heart of suicide prevention principles and practices.
Yeah. I was going to add to that is like really decriminalizing a lot of the approaches that we have on campuses. It's the same at UCLA where you do have campus PD come and handcuff students that are disclosing this. I know I had very similar reaction, and really thinking about how can we create within each campus a crisis response that is supportive, that is going to de-escalate, and that's going to link them to care. That is the most important thing from a crisis perspective is how do you reinforce their help seeking? Because for a lot of them, it's their first time sharing this. Two, how do you provide a supportive and validating environment so that it doesn't scare them off? And three, how do you link them to care if it's needed or appropriate at that time? I think those are the three things that I think are so important for campuses and different schools to have this crisis response that will have these three components.
Thank you. And we're getting so close to the end, unfortunately. I have an endless number of questions coming in for you all. But one thing I wanted to ask to kind of close is, you all do very sort of serious work where you think a lot about really difficult things. But I wonder what gives each of you hope in your work and propels you forward and makes you, sort of think about what's possible. So what gives each of you hope in this work? And maybe I'll start with Jocelyn since she's just spoke.
Yes. What gives me hope is to see how suicide prevention is really becoming the work of everyone. Uh, for a long time, it was the work of psychiatrists, psychologists, and social work. And now we're realizing suicide prevention is the work of everyone. And for me to see everyone coming together, even the participants in today's webinar, asking all these questions on how they themselves can improve their ability to ask others that may be suffering on suicide, that gives me hope that we're all as a community coming together and supporting one another. To me, that's the beautiful thing. Christine, what gives you hope?
I was thinking about this because there's so much that's changing for good. We're not always attuned to all of them, but at AFSP, the policy work, 50 state laws that have been passed in the last year that are pro mental health and suicide prevention approaches, even during this difficult time of political polarization. So far, mental health and suicide prevention, for the most part, have not been fallen prey to that divisiveness. These are universal human concerns, and so far that's been preserved in the advocacy public policy space. I think the number of industries like workplace leaders in construction and in law enforcement and technology and finance that we have the opportunity to work with to try to address what's going on in their industry, in their culture, their policies and practices. Healthcare, also very importantly, really should be leading the way. And I think lastly, when I get to talk to our volunteers at our chapters and they tell me how the work and their volunteerism or walking in and out of the darkness walk, and it's just the beginning of our fall community walk season at AFSP, that these are moments and ways that suicide loss survivors and people with lived experience their healing journey is facilitated, and the connections in the community. That to me is the most just incredible, those stories that we do here, and myself included. So lots and lots of hope.
As someone who lived in a dictatorship for over 15 years, I think that hopelessness is the biggest threat to humankind and to humans. What gives me hope is the redefining storytelling. I love storytelling, and I think that for the past decades, stories and storytelling is a tool that has been utilized as a good thing, but also has been utilized to perpetuate the systems of oppression that we're seeing, the stigma. And really, stories are really powerful. And I'm just glad that a lot of people are being more vocal about their stories and are trying less and less to stereotype individuals, to stereotype conditions through storytelling, and rather having a more optimistic, objective view of the world. And I think stories give me hope.
What a great way to end. Thank you so much for joining us. Thank you to the panelists for reminding me that this is all of our work and that we can all come together and do this together. And I've seen so much of it already from so many of you. Thank you so much to the audience for joining. Really appreciate all the great questions. There were so many questions, and I wish we could have gotten to all of them. We're going to be sending out a follow-up email with some resources from the American Foundation for Suicide Prevention, from Jed. There'll be information on, how to reach crisis hotlines like 988. And please share the information that you've learned today with the people in your lives and ask them about how they're doing and have conversations about mental health and, sort of just make this a part of your daily lives. We really appreciate you.
Thank you. Bye, everyone.
Thank you so
Bye.
much. Take care, everyone.